Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist based out of Oklahoma City. Today, I want to open your eyes to something you've probably never thought about. At least I had never thought about it. So we all know that the world is aging, right? And especially in the United States. Modern medicine has made our lifespan much longer. People are living to older ages. However, our ability to produce and make doctors and healthcare workers, whether it be nurses, nurse practitioners, etc., that is decreasing. So we have an increasing population who is also aging and needing more care and less caregivers to give that care. So the question becomes, who takes care of this aging population? Typically, when you think about that, you're going to say, well, they're family members, of course. But my guest today says that actually, a lot of times it ends up being children. And it's children of those family members. And when I say children, we're talking young children, middle school age children, sometimes high school age children. And the problem with that, there are many, which include these children don't know how to properly care for adults. They don't have the resources to do it. No one's taught them how. They start missing school. They are tired at school. A lot of them end up trying to drop out of school. And then the other issue with that is they become traumatized. They have trauma related to this. They have sleep disorders related to this. They end up with chronic health issues. They also don't end up graduating high school a lot of the times. And then that makes a, economic impact on the world as a whole. And so my guest today is going to shed some light on this. And she says that about 4.5 million children are caregivers for chronically ill people in the United States today, which is somewhat alarming. So Connie Siskowski is an RN and now has her PhD. So Dr. Connie was educated at Johns Hopkins, New York University, and Lynn University. Her doctoral research uncovered the high prevalence of caregiving by students in Palm Beach County, Florida. In 1998, she established what is now the American Association of Caregiving Youth. It was successful, and she now has the Caregiving Youth Project and Caregiving Youth Institute. This is a non-for-profit organization that helps young children understand how to caregive for chronically ill family members. Connie has contributed to multiple publications. Awards include Purpose Prize, Distinct Alumni Award at Johns Hopkins University, Top 10 CNN Hero, a star on Boca Raton's Walk of Recognition, and a faculty appointment to the Raise Family Caregiving Advisory Council. And so I hope that you find this conversation somewhat eye-opening, somewhat sad as well, but eye-opening, and just helps you realize that we do have this disconnect and this niche of need in this country. And I found it very fascinating. So let her explain to you how we have this whole generation of children that are actually caring for chronically ill people and what impact that's having on society and the economy. So today I have Connie Siskowski with me. She's an RN and a PhD. And we're going to talk about something a little different, but we're going to talk about the role of caregiver from a child's perspective. So she actually works with a social service type group that helps provide resources and education to children, like middle school and high school children who have chronically ill adults that they care for, whether it be their parents or grandparents. And so she just wants to shed a little bit of light on this. We were talking just for a second before we started recording, and it's kind of fascinating to think about this. And so she has some good points that she wants us to think about from a caregiver perspective, especially when we're thinking about children. So will you tell everyone, Connie, please, kind of how you got into this role and what you kind of do on a day-to-day basis?
Sure, I'm happy to. And thank you so much for having me. So, when I was in middle school, my parents were divorced and we lived with my grandparents, and I helped my grandfather. He and I were very, very close. But, when you're 11, 12 years old, I wasn't prepared for some of the things that I needed to do for him. And then I as his health declined, and he worked until he was 84, by the way, part-time. But then as his health declined, he needed more help. And so I moved into the living room to be closer to his bedroom. And then one morning in 1960, I went to give him his medication at 2 o'clock, and he was no longer breathing. I could still feel the coolness of his skin. And so not only the trauma at that time, and trauma wasn't recognized in children, but also then he was like my hero. He was, I learned a lot of compassion from him. And then he wasn't there, and here I was going into high school. And so I went on to be a nurse. I specialized in cardiac nursing. And lo and behold, he had congestive heart failure. And then, I really did a lot across the whole healthcare spectrum, everything from teaching paramedics. I moved to Florida. I was a licensed nursing home administrator. I moved to Florida in 1990. And at that time, I worked with hospice. That was a very grounding experience to be with someone when they were dying. And it was really interesting to see how family were affected or affected that dying process. So then I did some work in home care. I started a company called MDTU to do physician house calls. And then in 1998, I had the opportunity to go to the first international conference on family caregiving in London. And it was there that I learned about what they call young carers. And, I said, wow, I was one of them. And these are, minors who are providing care. And it could be for an adult or it could be for a sibling. And so I was remarried, and my husband encouraged me to get my PhD, which I did, expecting to have a bigger voice for all family caregivers, never expecting to be looking at the population of children in this role. But I had that opportunity. I took it. I had already started a nonprofit to provide volunteers to people who were homebound and caregiving families. It went to, in Palm Beach County is like the 10th largest school district in our country. And so this work that I did was the first in our country on a large scale. And it showed that of more than 12,000 kids, more than 1 in 3 who were caregivers were either missing school, having trouble focusing, not doing homework. But it was at a time when schools are starting to look at high school dropout and saying, what's wrong with the schools? What's wrong with the teachers? They weren't looking at what else is going on in the life of the child. And so I shared that data, and then the first national study came about, and it showed that this was in 2005, that there were at least 1.3 million children ages 8 to 18 in our country in that role. So with that came some media attention. And then there was another study a few months later that looked at young adults who dropped out of school. And 22% said it was to care for a family member. So between the national data, the visual, because people still have a hard time imagining that children are doing this. And that other study, we were able to get funding in the nonprofit that I had already founded to begin the first caregiving youth project in our country. And in the beginning, we called it Young Caregivers, the Young Caregiver Project. But then, young is so subjective. People didn't understand. They thought young was like you or people in their 20s and 30s. They didn't think about children in this role. And in fact, there's still no government support to recognize these kids. And you know what? It's really tough to learn when you're under stress. I'm sure you know that with your practice.
Yeah, I can only imagine, like, as a middle schooler, high schooler, not only is it difficult to learn when you're under stress, but it's also difficult to sleep and probably difficult to when you're stressed, your body doesn't absorb nutrients as well. So then a lot of these children probably aren't growing like they're supposed to, whether it be height and or mentally. Their emotional capacity to grow is probably diminished from the trauma or just the stress. And again, the lack of sleep. So there's lots of things that could be playing into that. And you pointed out before we started diabetes, right? So I mean, I've taken care of a lot of people with diabetes and especially type 1. And I never really thought about that. I have people who come in who are older or even, 40s and 50s who probably do need a lot of care at home, whether it be, helping with meals or making sure, their feet are clean or there's not a nail in the bottom of their foot or whatever it may be. And you pointed out that a lot of these kids are caring for people with diabetes. And so then you get into, are these children also administering insulin, giving them medications, things like that? And that can be probably pretty traumatizing for some children.
It definitely is. And sometimes so they enjoy the caregiving aspects, the taking care of someone, because it really is a two-way street. They don't always enjoy all the other things that go with it, where they have household responsibilities. Taking and giving medication is something that they're proud of, but yet they're scared about. They're worried, what if I give too much? What if grandma can't swallow the pill? And also, we're seeing, as I'm sure, a higher prevalence of kids on the autism spectrum. That's also a really difficult challenge for siblings who need to provide care. Maybe both parents are working, and it's really really hard on them because of their worries. And also, because they don't really have anybody to teach them what to do.
Yeah, and I can imagine that if a sixth grader or an eighth grader went to school and asked a teacher, how do I administer insulin or how do I draw this medication up from a syringe or how do I, whatever, the teachers aren't going to really have the answers to that either, right? Because teachers aren't.
Right. And it's outside of the purview of school nurses. They don't know what to do with it because it's not in the curriculum yet. So we have a pediatrician on our advisory council. Actually, on our national advisory council, we have a geriatrician who has been involved in adult family caregiving. He's at UVA. And he has taken this to heart. And so he's now teaching, and he's 91 years old, by the way, and teaching medical students, which is just so important. People today don't realize how the economy has impacted many of the families. And, then the choices, which we read about all the time, is do you get medication or food? So it's a very complex issue involving healthcare, education, and the community. So we work in partnership with the school district. So we have a formal agreement and we do a screening of kids beginning in sixth grade so that those who we work with are at the top 3 of 5 levels of responsibility. So it's not like a child is in our program, which we provide at no cost to the families, because they take grandma dinner twice a week or have dinner with her. They wouldn't be eligible. So these kids are often providing more than 20 hours of caregiving a week and do ADLs. They do bathing, feeding, maintenance care, help with mobility, as well as other, household chores, managing suctioning. I had one pediatrician say to me, Connie, before I met you, my focus was on my patient, not on his brother who was suctioning him. And so, and people take the work of these children who are really filling the gaps in healthcare because we don't have enough healthcare workers today to assist. One boy said to me, well, Dr. Connie, what would our country do without caregiving youth? And it's really true, because there is no one. One of the representatives, because we're trying to advocate and educate legislators so that there can be some support for these children, and small support that wouldn't be at any cost to the schools. And so anyhow, he said, well, children shouldn't be doing this. They should be in foster care. That's really not an option, because then who's going to take care of the person they were helping, and who's going to take care of them in foster care? You know, but it's a reaction of people who are uninformed, not knowledgeable, and often who live in like a little bubble and don't recognize what's really going on in families.
Yeah, you said a couple things that I think are worth pointing out. One of them is, think as a doctor, I never thought about that either, right? So I've had patients who I know are wheelchair bound or who have had strokes and can't give themselves their medication. Typically, when they come to their appointments, they would come with another adult, but I never thought to ask, hey, Linda, I'm assuming your husband, John, works. So when he's at work, who's giving you your insulin since you can't move your arms during the day, right? Like, who's making sure that you're not sitting in a, wet diaper all day? Who is bathing you? Like, we don't learn about these things in school. So that is a good point. And I guess you just always assume that it is some other adult, but sometimes you're right, it probably can't be. And then to think about, how does a sixth grader, seventh grader, eighth grader, ninth grader even learn these things, right? Because like sixth graders and this teenagers, like it's hard enough to get them to bathe themselves enough, right? So it's like you have to take a shower every day. You stink. But then how do you teach them to bathe an adult? And how do you do it where there is dignity for the adult and the child that's doing it? There's so many questions, because even as an adult, that would be difficult, right? And to your point, like 20 hours a week, that's a lot of time that they're spending caregiving and, probably cooking and it's just kind of crazy to think about. And then it also makes me kind of sad because, in other countries, probably, I'm assuming Japan, countries that are just a little more tight knit, have communities. I'm assuming what happens in those communities is neighbors help, family helps, friends help, right? Like, and so the children can focus on education and going to school. And in America, I feel like we're just so uncommunity, like, right? We're just discombobulated, and we don't have this sense of community anymore. And so unfortunately, things like that fall through the cracks, right? And it's just like people probably don't know how to ask for help, or they don't know who to ask for help. And then this ends up happening. And you said about what percentage of kids are actually caregivers?
Well, we know that there's at least 5.4 million in our country.
Yeah, and so think about the ramification of that. Here's my brain. The ramification of 5.4 million kids not getting proper education to be able to go out into the workforce and help grow our economy and help keep, America doing the things it needs to do. That's a lot of workers that you're taking out of workforce or just education in general. So then how do you make this better? If you have less people finishing school and less people going to college, and these might be the people that would be healthcare workers because they did it and they loved it, and but they're not even able to get through school.
Exactly, but with support, they do so well. Like our high school, our average high school graduation rate over 10 years is 98.3%. And so by investing in a program that supports these children and provides them with what they need, it really makes a difference to the child, to the family, and ultimately to society. Because if you graduate from high school, your taxable earning potential is greater. You're less likely to be involved with teen pregnancy or disease or crime and ultimate system dependency. And so it's really an investment in the child, and they feel cared about. And so it one of the things that we worked out with the school district is to be able to award them community service hours, because essentially they're volunteering at home. And at least in our school district, there's a requirement. You have to have so many community service hours in order to graduate high school. And so that's one of the things that that the kids can feel good about, hey, there is recognition for me. One of our activities, we do home visits, which are very revealing. And, we think that we've seen everything, and then you go into another home and you see something else. One of the situations was with a single mom with cancer. And at the end of our home visit, she relayed that her 15-year-old daughter, who was in our program, had said that she moved the mattress into the living room because the noise of the rats was so loud it didn't let her sleep. Having rat control was certainly nothing in our budget, but we got some, dollars, and critter control came in and they eliminated the immediate problem. But they said, if you really want a solution, and this was in a manufactured home, that you needed to build a rat wall. Well, I don't know if you've ever heard of a rat wall, but we had never heard of a rat wall. But what they do is they dig down a couple feet around the perimeter of the manufactured home and air conditioner and put in a barrier that the rats can't penetrate and get underneath. And so it's a solution. And that's what we try and do, is find solutions. So even for the children that, need specific help with, say, mobility assistance, we've developed 6 different modules we call it knowledge and know-how, to help them do a deeper dive. Another consideration, uh, I don't know how often you go into a drugstore, but when I go in, I see more and more OTC meds, for sleeping, for stress control, for this, for that. You can buy them, but there's no way to look at how do they interact with the other medication. We did a program with poison control, and they actually gave out Narcan to our families. Not that our families were involved in the opioid stuff, but they may live in a neighborhood where others are, and so then they had it. But we do have an overnight camp. We only have it for middle school children, and I would imagine you can understand why we don't do high school kids. So it's interesting. We have a campfire, and they go swimming and archery and all this kind of stuff that they never get to do otherwise. They still worry. And so after breakfast, after they've had a night away from their caregiving, we have them fill out a note card about what are you worried about, and how else can we help you? And their worries are profound. So even though they're away, they still worry. And that's why it's so important when they're at school, they worry, and that they are allowed to call home. Maybe it's not with their cell phone, because we don't advocate that they use cell phones in class, but let the school provide them a way, provide them a school phone so they can check in at home and decrease those worries so that they can study and learn.
Yeah, that's such a valid point. I know you were telling me before we started, there was a big news article, something on the news about cell phones in school. And obviously, you don't want kids just Snapchatting, texting on social media at school. But I had never even thought about some kids have a phone at school so that they can call and check on somebody at home. And so I can see where that would be, very hard to be in school all day long and know that somebody's at home and could be, sick or need something or whatever, and be thinking about that while trying to learn. Because, school is difficult as it is, not just the learning, but I feel like even after COVID, like, it's different, right? Like, there's different groups and you're trying to fit in and you're stressed about all, everything while trying to learn. But then if you're also stressed about somebody at home could be sick, I mean, it's just different. And I think it's kind of mind blowing and eye opening for a lot of people listening to this, probably because a lot of people have never thought about this. But it is true. I will tell you, I do know that I worry about the healthcare system in general in this country for multiple reasons, but the largest one is the amount of doctors, nurses, providers that we make every year. It continues to go down, which doesn't make sense to me because I know so many people who apply for med school and get rejected. And it's like, why are we not making more schools to educate people who want to help people when we obviously are at a deficit in providers in this country?
And the population is aging, needing more medical care.
Yes, and yes. And it's just there's so many issues with that. So I do think that it's very I mean, it's amazing that you've done this, but also that we're sharing this with people because I had no idea. So this American Association of Caregiving Youth, you guys founded it in Florida, but is this like a national thing or is it just in Florida?
So, yeah, Florida is its home. Boca Raton is its headquarters. As we started to share our results, people from other states have started reaching in. So we've developed a nonprofit franchise model, if you will, for affiliates. We also, and so the more recent ones are in Colorado and Hawaii. We work with pediatricians and others. We started a Caregiving Youth Institute, so we have an annual conference. We've done publications, participated in research, University of Miami, Miller School of Medicine, UNC Chapel Hill, and others. We're working, the whole state of Rhode Island has modified its policies, and we work with them to make accommodations for kids who are caregiving youth and so that they can have some flexibility in their schedule and so that their teachers know, say that they've been up all night and they didn't get their homework finished. So not that they should be punished, but let them, turn it in a little while later without getting penalized. So we have to celebrate the work of these children and value them. I mean, you can see a child pushing someone in a wheelchair and you think, oh, that's so nice. But who thinks about what happens when they go home? Because everything that they do is behind the closed doors. People don't understand. And one of our local county commissioners had said to me one day, well, Connie, maybe they don't want to know, because it's like there's so much to know that it's one more thing to deal with. But this is such an important investment in society's future as well as helping healthcare itself.
Yeah. Is there a American Association of Caregiving Youth in Oklahoma? Do you know?
And not yet. We have people have contacted us all over, so we are open, to beginning affiliates in other places. So we provide the support to them as they begin their program. So it's like a partnership with another nonprofit organization.
Yeah. No, I think that's very powerful. That's amazing work. I'm curious, Connie, as far as like when you see these children and interact with them, what do you think are the top things that like stand out to you? Like what sort of health issues do they have or do they struggle with? Is it mostly sleep? Is it mostly anxiety? Like what stands out with these kids? Do any of them end up like with behavior issues or substance abuse issues or what do you see?
Well, not so much substance abuse, and it's a whole different ballpark when the children are supported and valued. So then, they have purpose to their life, and that makes a difference. They learn life skills. One of the boys who graduated said to me, Dr. Connie, I didn't realize until I got out of school how much I knew that my friends don't know. So, in terms of their health, nutrition is lacking. There some of the neighborhoods the kids don't feel safe, so they don't have the opportunity to be outside and so I see that as an issue. Plus, with a lack of financial resources, it's hard to participate in sports or other, after school activities. You got to get on the bus. So their lives are different than their peers. And sometimes, there's still a stigma, say, grandma has Alzheimer's disease, and people hear about how some people become aggressive. So the other parents don't want their children exposed to that. And so, they can't have kids over. They can't do slumber parties and, what's normal for time growing up.
Yeah. Well, I think that that's very eye-opening, and so I appreciate you bringing it to our attention. Obviously, I appreciate all the work that you do. It sounds like, it kind of found you, which is always the best stories, right? How things in life just find you, you fall in love with them, and then years later you have this amazing organization that's helping children and youth care for aging adults. And to your point, like, I only see this getting worse because people are living to be older, and unfortunately, even though our lifespan is increasing, our quality of life is not. And so I see this all the time. People are living longer, but it's not great years. So modern medicine, I guess we have modern medicine to thank for that. We keep people alive, but not necessarily healthily. And so this will continue to be a problem. So I do think that it's good to point out, and obviously I appreciate you coming on and talking about it, but then for all the work that you've done to help all these kids, like that's really awesome. And to your point, giving them a purpose, like everyone needs a purpose in life. And so if they have this purpose and if they feel validated and like they're doing something to help, then obviously, they don't end up, hopefully they do graduate and they don't end up going down the wrong path. And maybe, these are going to be great caregivers, nurses, doctors.
Yeah, many of them want to go into healthcare. Like one boy wants to find a solution to MS that his mother has.
And that's what we need, because I mean, if you grew up taking care of somebody like that and you make it through high school, and I mean, you've made it through a lot of tough things in life, then you're probably going to do really amazing things, right? So you're used to doing hard things.
But it really has been a calling, because when I did this research, which was with the school district and Palm Beach Atlantic University, I got this phone call from the principal investigator, and he said, "Connie, your section, I had a family health section, had the most profound results of the whole survey." And so I just had the sense I have to do something about it.
And even to your point of maybe not even caring for adults, but caring for siblings, I can see that a lot too, where if you're the older sibling and you have a sibling with diabetes or whatever, and mom and dad are at work all the time and you're with the sibling on the bus when they get home and providing the snacks, I mean, that can be stressful too, right? Like if you have a little sibling that you're caring for. So it is, I mean, it opens my mind to definitely some different things I never thought of as a provider, but also just as a person as well. I want to end by asking you three questions that I ask everyone. And then at the very end, I'm going to ask one more. But don't overthink this. Very simple question, but people love this. So, what is one food that you feel is most beneficial and why?
That is a really hard one, because I really love pizza. And so
Pizza.
that, yeah. I
Why,
don't know
why do
that
you
that's,
love pizza?
I don't know. It's easy. It just tastes good. I don't know, but it goes well with champagne.
Pizza?
Yeah.
Okay. Well, that's a very interesting answer, Miss Connie. I bet people will love that. So we've never had pizza, and we've never had pizza goes well with champagne. So we'll stick to that. What is one thing that anyone can do that is 100% free that will benefit their health?
I would say exercise and breathe deeply. Breathe through your nose, relax, take time for you, be sure to exercise and have fun.
I would agree with that. All good things: exercise, breathing, and fun. And the last question I want to ask you is, what is one thing you wish you would have known about your health, particularly 35, 40 years ago, that you would have done differently?
I think I would have been in counseling sooner, because the trauma that I experienced as a child carried over into my adult life. And it wasn't until I was in counseling after I moved to Florida, which was in 1990, that it was pointed out to me, what the impact of trauma. And so that's why the work that I do today is not only for the kids today, but to help them tomorrow so that they don't have to suffer.
Yeah, I completely agree. I think trauma and counseling is very important, and especially probably in these kids. And we forgot to point this out. We talked about this prior to the episode starting, but not only in kids and kids being caregivers, but I also see this in my practice a lot. A lot of 40, 50, 60-year-old people now are also stuck in this kind of in between caregiver role that I think is important to point out. They have children that they're trying to care for, and then they have aging parents. And they're kind of yo-yoing back and forth between, like, obviously I have my immediate family that I am responsible for and caring for, but then I have these aging parents that I feel responsible for as well. And sometimes it can be very difficult to care for aging patients or parents more so than it can for small children because aging parents and elderly people have their ways and their set ways and they're not going to change. And so there's a whole nother dynamic as well of caregiving as you get older.
And a lot of times the parents don't recognize the impact on the children. I always remember a family I talked with in North Carolina, and the single mom was taking care of her parents who lived a little ways away, and she had a son who was graduating from high school, and he was really angry that his mom had to spend so much time with her parents that it took time away from him.
Yeah, so there's all different
It's very
aspects.
complex, and it's one size doesn't fit it all. That's why we offer a menu of services to our kids so that they and their families can benefit.
Yeah, and to your point, I think counseling is so good. And it's one of the things that if I could change one thing about healthcare that would instantly like happen right now to every human in the United States, what I would pick is that they all got counseling. Like I think that every single person would benefit from counseling, from seeing a therapist, from whatever, in this world would be just a very different place if people would have this outlet to speak to someone and then to learn how to deal with their emotions and the trauma that they've had and move past it instead of just being angry and blowing up. And we teaching people.
Having a sense of community, because with our society's mobility, you don't have that. But did you see on from the San Diego Zoo in the past couple of days they had the earthquake in San Diego, and in the zoo, you got to see it. All the elephants started feeling the shaking, and so they made a circle and had the little ones on the inside and they were facing out as to protect them. And if only we, could protect one another.
That's really cool. I did not. So, parting words, I've kind of started asking people about this too. If there's one thing that you hope anyone listening to this takes away from this, what would it be?
To help us with funding and to get policy for caregiving youth so that they don't have to wait until they're 18 to get any kind of government support.
Well, thank you so much for everything that you do. We'll make sure that all your stuff gets linked in the show notes, and we'll make sure that the American Association of Caregiving Youth, all of that information's in the show notes as well. And thank you so much for what you do and for coming and chatting with me today.
Oh, thank you so much. Really, really appreciate it. Thank you.
Have a good day. So that was a pretty powerful episode. I hope that it opened your eyes, your heart, and your mind to maybe just a different side of youth caregiving and chronically ill people in the United States. To be honest with you, as a healthcare provider, it's not something I really thought about. Although I did think about who's caring for these patients, I just always assumed it was an adult. So to know that there are millions of kids caring for chronically ill people is, alarming and heartbreaking at the same time. So thankful for the work that Connie does and the American Association of Caregiving for the Youth as well. If you found this interesting or would like to share this with anyone, please, please, please do. Make sure that you're following us anywhere that you get podcasts. So again, Spotify, YouTube, and Apple. We're on all platforms. If you're following us, you'll be sure to be notified anytime we drop a new episode. Also, social media, check me out on all the outlets. I'm on all of them. I love to chat with you guys. I would love for you to tell me what you want to learn more about. Give me podcast topics or guests, and I'll get them on here for you. And last, remember that Modern Endocrine is a virtual practice as well. We have a license in 39 states and counting. Our goal is to be in all 50 states by the end of the year. And we will see you virtually from the comfort of your own home or wherever you'd like to see us from. If you're in Oklahoma City, come visit our state-of-the-art clinic, but we can also do virtuals as well. We would love to help you with any of your healthcare needs. We do love to focus on, foundational functional wellness. We do look at mitochondrial health, gut health, hormones. We specialize in all those things in addition to weight loss, but we see a lot of just chronically ill people as well to try to get you going back in the right direction. We have an amazing health coach who also can help with just nutrition or any sort of coaching that you need as well. Thank you so much for your time this week. I appreciate you taking the time to get some education and learn more about health in general. And we'll see you next week on the next episode.
The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.